Good morning, everybody. My name is Rob Lilly, and I'm the director of Lilly Inspired Training. And we're going to talk about an injury today that I see often with athletes that pertains to low back pain, sometimes hip pain, and certainly knee problems. So athletes tend to have a lot of issues with hip stuff. And in this case, we're going to talk about how to get our psoas and our hip flexor group all kinds of relaxed. And we're going to do that by manual work. I don't expect anybody here to do manual work, but I'm going to show you what's happening by showing you the manual work with Bobby here, and then I'm going to show you how you could do some things at home that will help you to get your kind of hip flexor areas relaxed, which also will help with back pain to alleviate some discomfort in our lower back. So I'm going to explain what we're doing as we go, and then we're going to certainly put you guys in a position to see what tools we use as well. So this is Bobby. Bobby has had hip pain at times in his running career. So first thing we're going to do is locate the big hip bone right here, which is easy to locate. It's a very large bone. And then we're going to locate right inside that bone, going towards his belly button, his psoas muscle, which is a muscle that basically allows us to pull our knee toward our hip. So I'm going to take my fingertips and I'm going to push in to his psoas, and we're going to get some intense kind of muscle tightness in there. And all athletes that I've ever worked with have tight psoases, so chances of you having one is pretty high. But I'm going to put some pressure in there. And as a person who works on athletes like this, I'm happy to do this for athletes, but what I'd like you to do, and what we're going to do in a moment, is put a tennis ball in that area, and then we're going to have Bobby flip over so he can lay on the tennis ball. We want to make sure that the ball, when we get a ball, it's not on the bone, but rather more towards the belly button, and then he's going to lay on it kind of right at his midline, just inside that bone structure. So we'll do that in just a moment. Okay, questions at all? Okay, so I'm going to have Bobby turn over. He's going to keep that ball closer to his belly button than the bone itself, so he's going to have it internal. He's going to lay down, and he's just going to relax. You'll see that his upper body is totally relaxed because his head's on his arms, which is what we want to have happen, and then he's literally just relaxed all the way down. Two things that are happening right now. The ball itself is sitting on that psoas muscle right in here. It's starting to basically give a massage type feeling to that area, and it might feel a little uncomfortable at first. Bobby's going to take 3 or 4 deep breaths and allow us to basically get that musculature to relax into the ball. After 3 or 4 deep breaths, Bobby's going to bring the heel of the side that he's working on up towards his butt, and then he's going to elongate that out. As he does that, it stretches out the quadricep muscle on the front side underneath the psoas, because all of these muscles are connected. So he's going to bring his heel back up to his glute again. When he brings his heel towards his glute or his butt, he's stretching out that quadricep muscle, which is connected to the hip muscle. We're going to go back out. Okay, now we're going to put a little bit of intensity in so we get that quad to stretch with even more intensity. He's going to bring his heel up. Now he's going to squeeze his glutes. When he squeezes his glutes, his hip's going to push into the ball and his quadricep is going to stretch. He'll relax his glutes first, and then he's going to put his leg back down. We'll do that one more time. So bring his heel up towards his butt. He's going to squeeze his glutes. His quad extends. He's pushing into the ball with his psoas, the muscle in his hip. And then he's going to relax his glutes and put that back out. Once we do that 4 or 5 times, usually we do a minute for the laying on the ball. We do about 45 seconds to a minute. And then we'll do heel towards butt 3 or 4 times. And then heels toward butt 3 or 4 times with a glute squeeze. And then after we do that, I'm going to have Bobby open up. But before I do, hold on real quick, Bob. I want you to notice that Bobby has this curvature in his back. We call that a C curve because it's shaped like the letter C. And that tends to put a lot of stress on the lower back and on the top of the hip through what's called the SI joint. We want to make sure, if we can get the SI joint to stretch out, and we can get this muscle called your QL to stretch out. So I'm going to show you how to do that right now. This will help with your hip feeling better. So Bobby's going to open his hip and take the ball out. And then he's going to take this foam roller and put it under his hip. But what I want to talk about for a moment is, many of you, I'd rather you use like a rolled up mat like this. Roll up that mat and put it under your hip, because that will help to elongate this muscle system in here, and it'll help him feel better through his hip. Today we just have a foam roller, so we're using that to show the effects of what a rolled up mat would look like. So this one's too close to Bobby's butt because his butt's higher than his back. So I'm going to pull it forward a little bit, going toward his nose. He's going to lay down and relax, and what you'll notice is from his shoulder blades to his butt, we've now straightened out this musculature through here. This muscle is called your quadratus lumborum. You don't need to know that, but this lower back muscle does a lot of work when our glute is unavailable, and oftentimes when our psoas is tight, our glute is not as available because our back muscle is doing too much work. So right now we're stretching out the back. We already stretched out the psoas. Once we get that hip muscle called the psoas and the back stretched out, Bobby will have more access to his glutes when he's running. So we'll do this, we hold for 30 seconds to a minute, take this thing out, Bobby's gonna relax and just lay back down. He's gonna hold out for about 30 seconds to a minute to finish up. So that's how we're gonna take care of psoas pain or hip flexor pain or low back pain that's coming from the front or quad pain and knee pain. These are great ways to help with your knee as well.